Hello and welcome to our channel Forensic Science Public Desk India, and this is lecture 9 of Forensic Medicine, where we are going to deal with forensic thanatology for the second part. And here we are going to learn about postmortem changes after the death. Introduction. The accurate determination of time of the death is important due to its role in explaining possible criminal acts and determination of appropriate civil repercussions. So the change which occurs after death, that those are helpful in estimation of the approximate time of death, and this can be classified understood in three different parts. That is, immediate changes we can see. So as soon as death occurs within 1 hour and half an hour, what changes we are observing, so those are known as the immediate changes, and those are again classified and we'll learn those. Coming to early changes, these are the intermediate stage, so where from 1 hour to 48 hours, whatever the changes which are occurring in the dead body, those are considered into the early changes. And late changes will be started right from 36th hour or 48th hour, where putrefaction stage will start, and till the mummification stage, these particular things are known as the late changes. So like this, in three particular classifications categories, we will learn what are various stages of death, and how complete decomposition of the dead body will occur. Immediate changes, so irreversible cessation of function of brain including brainstem can be observed first. So this is the earliest sign, and the stoppage of functioning of central nervous system will be observed, where insensibility and loss of both sensory and motor functions can be seen. So there is loss of reflexes, no response or no tonicity. Though you apply the electricity, you cannot see any of these particular responses. So prolonged fainting attack or vagal inhibitory phenomenon can be resulting in this particular brain death or a brainstem death, and this is particular cause of death. And coming to the second one, irreversible cessation of respiration. So complete stoppage of respiration for more than 4 minutes will usually cause the death. So we can do some tests like inspection. There is no visibility of respiratory movement, first thing. Second thing, palpation. There is no respiratory movement which can be felt. You can touch it and you cannot sense any respiration. And auscultation, then you can see no sound of breath. This is called auscultation. And feather test, mirror test, Winslow test are very primitive tests which can be conducted. So Winslow test means you take a bowl of water, put it on the dead body's chest. So when chest is moving, the reflection of the water can be seen, and this shows that person is alive. And if it is not moving, he is dead. Then feather test, you can put a feather near the nose and you can test. If there is any movement, then he is alive, and if there is no movement, he is dead. Very simple. And mirror test, put a mirror near the nose, nostrils, and if there is any haziness formed, then he is alive. If there is no haziness formed, he is dead. So this is the test for respiration. And coming to irreversible cessation of circulatory system, so stoppage of heartbeat for more than 3 to 5 minutes is irrevocable and results in death. So radial, branchial, femoral or carotid pulsations, that means checking the pulse near the wrist, near the neck, near the leg or any other part where pulse can be sensed will be done. And auscultation of the heart, put your ear near the heart of the dead body and or the person, then you will, if you are listening the sound, then he is alive, otherwise obvious he is dead. And ECG scanning, you can see there is no particular depression and elevation in that particular machine, so all flat line will be seen, so that it indicates he is dead. Then other tests are also conducted, like Magnus test can be seen. So take a ligature and put it around the finger, so there is no blue color formation. If you take any of your friends who is alive, and if you press the finger, you will be seeing blue color discoloration. It is present in living person but not in the dead. And diphalanus test, that means transillumination. So the web region of two fingers, if you are transilluminating some light, there is no red color seen in that particular finger's gap. ICART's test, so this is a fluorescent dye which is injected into the body. If a person is alive, then we will be seeing yellow green color discoloration, but if he is dead, there is no color development. So pressure test can also be seen. Fingers appear pale, fail to show any reddish color, and removal of this pressure over it, it will be again pale. So there is no color change even though you apply certain type of pressure on the fingers. Early changes. So first one, changes in skin and facial pallor. Skin becomes pale and ashy white due to stoppage of circulation and drainage of blood from the capillaries and small vessels. The skin loses its elasticity and face looks younger and due to loss of creases. The lips appear brownish, dry, hard due to the drying. So you can see the image here. Actually there is no wrinkling and so face looks a little fresh and good. The lips are a little dried. Okay, so primary relaxation or flaccidity of the muscles, that means muscles are becoming very relaxed and there is no stiffening kind of thing. This is occurring in a starting stage, and the reaction is alkaline and responds to electrical stimuli. That means the muscle cells are still alive, it is taking the electrical stimuli. Okay, then contact pallor or flattening. The areas which remain in contact with the ground become flat and blood from vessels of these areas are pressed out, and this continues even after the formation of postmortem staining over the surrounding areas. Then we can see other stages like the changes in eye, Algor Mortis, Livor Mortis, Rigor Mortis. We will discuss this in other slides. Changes in eyes. Loss of corneal or pupillary reflexes. It may be seen in all the cases of depth insensibility, and there is not reliability sign of the death. So that is, it can be varying, you cannot completely rely on this. If you take a torch and put it in the eyes, there is no pupillary reflexes which we can see. And the pupils, if you see, pupils are generally dilated after the death because of the relaxation of the muscles of the iris. So shape of the pupils are circular during life, but due to loss of tone and elasticity ciliary muscles after the death, the shape of pupils can be changed. That means you can see here the pupil size is different in this image. So if you are comparing it from the left to right eye, this particular size will be differing, and obviously it is dilated. And opacity of the cornea can also be seen in this image. So it is if the person is alive, the eye, whatever eyeball is there, it is glossy and it is looking good, and iris pattern will be very clearly visible. But if it is dead, then iris pattern cannot be seen, and opacity of the cornea can also be observed. Haziness and drying, deposition of dust and debris over it can also be observed. So here you are seeing the red color spots on either sides of the eyeball, right? So those are called as tachynorae, that means black line. So if eyelids remain open for more than 3 to 4 hours after death, there is formation of two yellow triangles or this particular two red color triangles. If it is prolonged, then this is known as tachynorae. And causes is because of drying, desiccation, deposition of cellular debris, mucus, dust exposed to from outside. So these are the things. And cornea becomes permanently hazy after 10 to 12 hours. So one thing you can see here, if you are pouring one drop of water inside the eye after the death, you can maintain the cornea glossily up to 7 hours. And if you are not pouring anything like that, only 2 hours you can see the glossiness in the eye. If you are not doing anything, after 10 hours to 12 hours, what will happen? The complete opacity will be becoming permanent. There is no change in that. Okay. So the changes in retina or loss of intraocular tension. If the loss of intraocular tension occurs, the eye will go inside the eye socket, it will be getting inside because of there is no tension, there is no muscle contraction, it will be going inside. And the changes in trachea means retina means the blood pressure will not be there, and retina can be observed without any blood, and it is segmented, fragmented in area. Algor Mortis. Algor Mortis is the coolness of the death or chill of the death. It is the cooling of body that normally takes place after the death, where the body temperature equilibrates with the environmental temperature. So Algor Mortis is usually the first sign of death beyond the obvious, and then it will be leading to Rigor Mortis. Sometime after the death, the temperature of body will falls and tend to get equalized with the environment surrounding. So this is based on Newton's law of cooling. So the surface outer temperature falls more rapidly for some time than the inner core temperature. That means if you touch the body, it will be cooler, but still inside it will be little high in temperature. And loss of body heat occurs by conduction, radiation and evaporation when the body is at atmospheric environment, and by conduction, convection when body is in water. So there is a difference. So you can see a graph here. So this particular red color line will be saying that the temperature is gradually decreasing. So the temperature will be decreasing up to 12 hours, and at right 12 hours you can see a black line coming from the bottom where the temperature is increased, okay, and it is reaching till the 12th hour, and where again temperature will start increase. So again green color line will be again giving us a Livor Mortis temperature. So all these different curves are indicating the temperature indication of various stages according to their individual activities. So you can see the temperature fall down up to 12 hours. Then methods, if you see, so we can check the temperature in the rectum by using 12 to 13 inches of thermometer. So normal chemical thermometer we can take and we can measure the temperature. Rectum is the first thing, we can put the thermometer inside the rectum up to 8 to 10 centimeters above the anus, and external auditory meters, that is inside the ear, we can keep, and subhepatic inferior surface of the liver, that means onto the side of the rib cage we can puncture the particular area and insert the particular thermometer inside the liver from the sideways, so that we will be getting the actual inner core temperature of the body. Nostrils up to cibriform plate, so we can insert the particular thermometer inside the nose. Intercerebral, so inside the scalp also we can insert the particular thermometer and identify the temperature. So the average rate of fall of body temperature is 0.4 to 0.7 degrees Celsius per hour, and the body attains environmental temperature in 16 to 20 hours after the death. So these are the important points, and you can see the formula here. So the normal rectal temperature, you have to note it down. Measured rectal temperature should be noted down. So normal rectal temperature will be around 35.7 minus to 37.7 degrees Celsius. So basically if you are taking 36 degrees Celsius for southern India areas, or if it is North Indian areas, again the climate changes, and also whether it is a summer season or winter season, those will also be relying. So those will be considered, and normal rectal temperature will be noted. Then whatever it is measured inside the body, that will be taken, and it will be divided by rate of fall of temperature per hour. So once you take it now, after half an hour, after 1 hour, like that if you are taking, you will be getting the denomination part of this particular formula. So this is how the Algor Mortis will be there, and there are various factors which are also affecting the Algor Mortis, like environmental temperature, air movement, humidity, media of disposal, where it is there, whether it is buried or what, or built of cadaver, whether it is a very hefty cadaver or very weak cadaver, or age and sex of the cadaver, and we can see clothing, covering of the body, position and posture of the body, mode of the death. So what all are these? These are giving the various factors and affecting the Algor Mortis. Postmortem caloricity. In this condition, instead of cooling, the body of the dead will be remains high for initial 2 hours or so. So this is due to the postmortem glycogenolysis. That means the compulsory phenomenon which occurs in all dead bodies and which starts soon after the death produces up to 140 calories. Similarly, it will be increasing the inner body temperature. So cause of death, the death occurred due to the infectious diseases, septicemia, bacteremia. Heat is produced by action of infective organisms which are eating away the internal organs and tissues. So death is preceded by severe convulsions. Then also you can see this particular temperature is increased. For example, strychnine poison, where convulsions are very common and death will occur. In case of death due to heat stroke, protein hemorrhage or heat regulation severely disturbed before the death. So in these conditions also we can see the temperature is increasing. So postmortem caloricity is a clarification for misconception in Algor Mortis. So high environmental temperature is also one of the factor which will be increasing the temperature inside the body. Some of the heat will be absorbed from the outside environment. So this is the postmortem caloricity. And coming to medical legal importance of Algor Mortis, so it is can be used for sign of death, or it helps in estimation of time of the death, rapid cooling of dead body, and how it is useful for time since death. So we can do the rectal temperature identification, and we can say how much time it's been the body is dead, etc. Postmortem staining are also known as Livor mortis. So postmortem staining is bluish or purplish red discoloration resulting from gravitational settling of blood in toneless capillaries and venules of dependent parts of the dead body. So general site is under surface of the skin and superficial layers of the dermis. So generally if the body is in supine position, backside you can see the postmortem staining, and if the body is in prone position, then in the front part, if it is sideways, in the side part you can see the postmortem staining. So what is the cause actually? After the stoppage of circulation, there is the stagnation of blood in the vessels, and it tends to sink by force of gravity in the capillaries and venules of the dependent parts of the body. So the upper portions of the body drained of the blood are very pale in color, and the backside of the body where the complete blood is settling towards the gravitational pull will be seen in the red color. So how it develops? So in early stages 30 to 1 hour, it consists of discoloration patches in 1 to 2 centimeters. Small patches can be seen on the dependent surface, and this is misunderstood as of bruises. So after 3 to 4 hours, if you see after 3 to 4 hours, these small patches will increase in the size, and they will be becoming uniformly stained large areas, and complete area will be stained. So it is usually well developed within 4 hours and completed in 5 to 6 hours. So after this particular completion, if anything is moved after that also, if you are seeing from the 4th hour to 5th hour, the body is moved to the second side, then also we can see light patches, not so fixed patches, but whatever which occurred firstly, that will not be removed, so that cannot be changed. So fixation, if you see after complete formation of postmortem staining, if the body is undisturbed, the staining gets fixed in 8 to 12 hours and persists until the putrefaction sets. So at this stage lividity does not disappear if finger is firmly pressed against the skin. So first before 4th hour, if you are pressing the skin and removing your finger from the skin, then you can see the pale color, red color, the color change will occur. But once the fixation is happening, if you press the postmortem stain also, it will not turn into pale color, it will be still in the red color. So if the person is wearing a shirt or any other folded kind of things, so here in the image you can see incomplete staining because of some presence or some incompleteness on the ground or on the surface. If the position of the body is altered after fixation, the staining will not be changed and will remain as such, though the color may fade slightly in intensity. So this particular small change can be observed, but the postmortem changing will not be changed. Then coming to the distribution, so the particular supine, we as like we have discussed, if it is in the supine position, right from the neck the particular color change will start right from the neck till the back, and then it will be going till the limbs and the hands. Then when it is the prone position, it will be starting with the neck again and the face part, and it will be passing throughout the body. And if it is sideways, the blood will be settling to the sideways, and suspended vertically, then the postmortem staining can be seen near the lower limbs, in the legs, and the postmortem staining will be most markedly in the legs and the external genitalia. When the body remains submerged in the water, then we cannot see very marked level of postmortem staining, only little amount of changing can be seen. So what will happen after the postmortem staining? So it will merge with the putrefaction changes. So next stage will be of putrefaction. So initially there is hemolysis of blood and the diffusion of blood pigments into the surrounding tissues, where it undergoes secondary changes later as decomposition progresses. The staining becomes darker in color and turns brown and green, blue before disappearing and destruction of the blood. So what are the various other features of postmortem staining? So as like we are seeing in the external part of the body, same changes will be going on inside the body. That means the organs like liver, kidneys, heart, whatever are there, those are situated in the middle region, in the core region of our body. So they are also having the blood circulation and blood. So those particular blood will also be coming to the lower level due to the gravity, and we can see certain kind of things like hypostasis in heart can stimulate myocardial infarction. That means some kind of blood vessels inside the heart may get blocked because of the blood clotting kind of things, and in heart it may congest with pneumonia. Dependent coils of the intestines appear strangulated, but it is not strangulated because of postmortem staining. Blood vessels becoming tightened, then we can see this strangulated intestines inside the digestive system. So the color of postmortem staining is usually bluish to green color. And medico-legal importance of postmortem staining: it can give us sign of the death. The time since death can be roughly estimated and indicates posture of the body especially. So how was the posture of the body, whether it is supine position or prone position, sideways or hanging in position. So cause of death may be judged distribution and color of postmortem staining. So early phase of formation, it may be confused with bruises. So abrasion or whatever the bruises marks will be there, so those will be mistaken with this, not abrasions. So it may be also having hemorrhagic spots on skin due to the blood diascaresis, may be mistaken for the postmortem again. So these are the various points. Rigor mortis, also known as stiffness of death, is the state of the muscles in dead body when they become stiff or rigid when some degree of the shortening. So the phase of primary relaxation of muscles continues for about 1 hour. So first the muscles will be relaxed, as like you see in the first image, and about 1 hour after that the stiffening and the rigidity of the muscles will increase. So this indicates the molecular death of the body is started. That means till that particular time muscles are still active, but after the death, after 1 hour, what will happen, the cellular level muscles will also be died. So what is actual mechanism behind this? Muscle fibers contain bundles of myofibrils, so which consists of two types of protein filaments. One is actin and other is myosin. So at rest, actin filaments and the myosin filaments will be separated and they will be relaxed in level. So when it is contracted, as like you see in the second part, so both are merging together and they are becoming stiffened. That means when you are applying certain energy, then it is stiffened and contracted muscle. So maintenance of this condition of muscle is due to presence of ATP above a certain level. On nervous stimulation, hydrolysis of ATP will occur and ADP and phosphate with liberation of energy, which causes the contraction of the muscle fibers. So extinction of the actin filaments more inside the myofilaments will be occurring. So this is actual process. So when death occur, it is continuously hydrolyzed of ATP, and after some time there will be no glycogen available in the muscle. So there is resynthesis of ATP, and in this process, once the muscle glycogen exhausted, no further resynthesis of ATP is possible and muscle loses the softness. So at the time it will become very rigid in condition, as like you see in the third image. This is a muscle rigor. So both the actin and myosin, whatever are there, those are getting binded together, and where you can see the rigor mortis. So the pH at this particular stage will be 5.5. Releasing of autolytic enzymes stored in lysosomes takes place, and the major proteolytic enzymes are cathepsins and calpains. These enzymes act at myofibrillar proteins and hydrolyze them. As a result, the actomyosin complex is broken down and muscles become soft again. So this is known as resolution of rigor. So first we have seen relaxation, then we have understood the contraction of muscle in natural phenomenon. After the death, how rigor mortis will take place because of complete consumption of ATP from the glycogen, and now we are seeing the stage where again relaxation occurs because of autolytic procedure, this means leading to the putrefaction. So muscles which are generally involved are voluntary and involuntary, both will be there. Smooth muscles, striated muscles, all muscles will be involving in this particular rigor mortis procedure. And in the conditions of tropical countries like India, we can see 1 to 2 hours after the death rigor mortis will be onset, and it will be persisting up to 12 hours. And in northern India, so you can see 18 to 36 hours of the time, or 24 to 48 hours of the time in winters. So this is a prolonged based on the temperature what is there outside. So order where it will start and how it will be going on. So this point you have to be noted down. Neston's law. So according to Neston's law, it first appears in the muscles of eyelids, then in the jaw, then facial muscles, then neck and thorax, then upper limbs, abdomen and lower limbs. So this is how the sequence of rigor mortis is setting in body. That means stiffening is one by one it is occurring. So when it is up to 3 to 5 hours after the death, if you are checking the eyelids, this has stiffened. And if you are checking the facial muscles or jaw, then it is if it is a rigor mortis, then 4 to 5 hours you can say. And upper limbs you can check, it is 5 to 7 hours. And lastly, if you are checking the legs, 12 to 11 hours in this particular time you can check the legs. If the rigor mortis is set, then it is 11 to 12 hours time it has been taken. So similarly, the particular reverse reaction of rigor mortis will also be taking place in this particular pattern only. First eyes, then facial muscles, then thoracic part, abdomen part, then hands and legs, like that the rigor mortis will be settling in the reverse side. And testing of rigor mortis can also be done. So like this way, in the eyelids you test, or neck you test, or hands you test. So from right from the facial parts till the legs part, if you test, that's enough. So these are the various points related to rigor mortis. And coming to the medical legal importance, we can identify sign of the death and indicates the molecular death of the body. And during the early phase after the death, it helps in estimation of time after checking the stiffening of each muscle, and it indicates the position of the body at the time of death. And some conditions, the dead bodies which may imitate or stimulate rigor mortis are also there, like cadaveric spasm. We will discuss this. So these are misconceptions of the rigor mortis. So this particular cadaveric spasm is first one. Cadaveric spasm is a condition in which the muscles of the body which were in a state of contraction immediately or before the death continue to be same so after the death without passing through the stage of primary relaxation. So as like our discussion started, first the primary relaxation will occur, then only the rigor mortis will start. So in this cadaveric spasm, this is a rare condition where the person is holding something, then at that particular time the muscles which were there holding something very tightly, and already complete ATP is consumed and muscle is in the contraction position. Okay, so somebody is hanging on the mountain, okay, he is holding rocks and he fell down. So while he is holding that, his complete ATP molecules and his complete glycogen in the muscles of fingers are consumed, so that the muscles are still in that particular stage, and after falling down on the ground he will die. And the still rocks whatever he is holding, whether it is rock or we can see in the image grass because of a drowning case, or if you see the firearm or stab injury case, then you can see firearms or weapons in the hands. So like that in struggling cases you can see something is in the hands, generally to the hands we can see the cadaveric spasm. So then we can also see the heat stiffening and cold stiffening, where if the body is subjected to heat exposure that is more than 65 degrees Celsius, then pluralistic condition can be seen, where the body will be stiffened, and due to the fire accident cases, in that particular cases you can see this heat stiffening. Without going into rigor mortis, this particular condition will occur, and as the putrefaction stage sets, this will be going off. And cold stiffening, this is seen when a body is exposed to the freezing temperatures for a reasonable period. The tissues become frozen and stiff. So freezing of the bodily fluids, particularly at the tissue level, and the synovial sacs of the joints, at the joints, that particular fluid, if it is stiffened, hardening of the subcutaneous fatty tissue will be giving us this particular stiffening. So this may be leading us to a wrong perception whether it is a rigor mortis or what. So late changes can be classified into three types, that is putrefaction, adipocere formation or mummification. So adipocere formation or mummification, these are the modifications which occur due to the decomposition processes. Putrefaction is a natural particular stage, and putrefaction is a process by which complex organic body tissues will break down into simpler inorganic compounds or elements due to the action of saprophytic microorganisms or due to the autolysis. That means the inside our body, whatever bacteria or whatever the enzymes which are there from the cytoplasm of various tissue cell organelles will be coming out, and it will be consuming on our body itself and damaging all the tissues, and making the complex molecules into the simple molecules. So microorganisms which are generally involved are Clostridium wilchi, so Staphylococcus diphtheroides, Proteus. So these are the few types of microorganisms which are generally seen. So you can see the first image, very nice image it is. We can see all the features of the putrefaction. So first one, you can see the microorganism Clostridium wilchi is the microorganism which is present in the small intestine, that means into the lower abdominal area. So from there the putrefaction will start, from where the particular microorganisms, bacteria will be entering inside the blood vessels, consuming the nutrients inside the blood vessels, and it will be passing throughout the body. So in the particular region, that is right side of ischiac fossa, you will be seeing certain kind of nerves are visible, blood vessels are visible. So in this image you can see the blood vessels are visible. So this is due to the bacteria and microorganisms which are producing certain kind of chemicals and the metabolites due to the particular reaction into the blood vessels, and then you can see this particular thing. So this thing can be regarded as the marbling of skin. So discoloration, then marbling of skin. Autolysis means bacteria feeding on our own body. It can be muscle or it can be any other tissue. So whatever it is there are certain timings which can be seen this putrefaction into. If it is 12 to 24 hours, then you can see gas accumulation inside the abdominal cavity, and it will be, the body abdominal cavity will become very fat. And if it is 24 to 48 hours, subcutaneous tissue will become very fatty and it will become emphysematous, and breasts in female, scrotum and penis in males will be getting swollen, and tongue will be coming out, and eyeballs will also be falling out. And if it is 48 to 72 hours, the prolapse of uterus and anus. So if you are seeing the order of this particular putrefaction, it will start in the lower abdominal area, and it will be passing towards the thoracic area, and it will be passing to the facial areas, and it will be disrupting all the tongue and the eyes, and the limbs will also be getting fatter later on stages. So like that, if you see at 48 and 72 hours, though the anus and the uterus are near the lower and small intestines, it will not get damaged easily. So if you are still getting a dead body from the putrefaction stage, if you are checking whether the presence of uterus is there or not, if it is there, then you can identify the sex of the particular deceased person. If it is 3 to 5 days, teeth, anterior and premolars will become loose, and skull sutures separate, and liquefaction of brain matter comes out, and especially in children, skin of the hands and feet may become off. So all the particular separations will occur because of more decomposition. And if it is 5 to 10 days, qualitative putrefaction stage, that means complete liquefaction, the body will become black and a black color liquid will be coming out. So if you see any case where hanging is there, at the time the complete body will become and become black, and this particular fluid kind of thing will be falling down. So this particular case is seen. So prostate and the uterus are most preserved kind of organs in our body, which will be getting decomposed very lately. Then if you are seeing adipocere formation, Adipocere is the formation of offensive, sweet, rancid smell, soft whitish, grayish, whitish, crumbly, waxy, greasy material occurring in the fat tissues of the dead body. It is a modification of the decomposition. So time which is required will be depending upon the hot and the moist environment. It will be taking around 1 week to 3 days. So a very prolonged procedure where the complete body will be becoming white in color. Adipocere consists mainly of fatty acid formed due to the postmortem hydrolysis and hydrogenation of the body fats. The process needs water, which is provided by the body fluids and the soft tissues. Then the chemical reaction essentially involves conversion of unsaturated liquid fats, that is, you can say oleic acid, to saturated solid high fatty acids like palmitic acid, stearic acid, hydrosteric acid, or mostly palmitic acid can be seen. So this is a particular mechanism of adipocere, and the distribution will be there where it will be starting from the face region and buttocks or abdomen, intestines, wherever there is fat, then there you can see the first onset of this particular adipocere formation. And this particular factors like environmental temperature, moisture, bacterial infection, etc. will be contributing to the adipocere stage. Then when it is coming to mummification, it is the rapid dehydration, desiccation and shriveling of the dead body from evaporation of water with preservation of natural appearances and features of the body. It is a modification of putrefaction. Dry decomposition will be occurring in this stage. So the entire body will lose its weight, become thin, stiff, brittle and odorless. The process is normal decomposition of the dead body is prevented as the growth of microorganisms is retarded. So like that you can see the mummification, you can see the last image, that is the mummification. The body will be intact, it will be naturally decomposed without the involvement of internal enzymes or the bacteria. So time required for mummification, it varies between 3 to 12 months or longer than that. So after this particular stages, you can see the body is completely dead, and skeletonization is one more stage. So in the skeletonization where the body will be taking 1 month if it is in open air. So if you are seeing the body in open air, 1 month is enough to get skeletonized. If it is buried, 3 to 4 months it may take, and if it is any other condition, sometimes it may also take up to 1 year. So whether it is in the coffin box or it is directly buried or some other conditions. So these are the late stages of the postmortem changes. So in this video we have clearly understood various stages of postmortem changes, and I hope you have understood all the concepts. Thank you for watching this video.